cure some of the most deadly forms of breast cancer. Doreen Gensler reports.
My grandmother had breast cancer, so because she had breast cancer, that was always a focus for me. I've always checked, and I've always gotten just regular checks.
Even though Keona Clark was well aware of her breast cancer risk, the 37-year-old was still shocked when she found a lump underneath her right arm.
It's like you know that you're going to be okay, but at the same time, it kind of makes you try to accept the fact that you may not.
Clark was diagnosed with triple-negative breast cancer, a disease that's known to be more aggressive and less responsive to standard treatment. Her doctor didn't make her feel any better either.
She was just like, oh my gosh, this is the worst kind you could ever have.
But instead of dwelling on her cancer, Clark found hope in a clinical trial at Georgetown University Medical Center.
I kind of felt like it was my duty, because it runs my family, and I'm always for, I guess, trying to find a better way, or for people who may go through it also.
The trial is called I-SPY. Its purpose is to investigate whether a tumor's DNA can help determine what type of treatment patients should undergo. Oncologist Dr. Minetta Liu is leading the research.
It's smarter. It's the hope that we can avoid unnecessary side effects from drugs that won't work. And it's also hoping to speed things up to get the right drug to the right patient.
Right now, most breast cancer patients will undergo surgery first, then chemotherapy, and possibly radiation. This trial is looking into whether using new types of drugs called biologics can help shrink tumors before patients ever get to surgery. The type of biologic a patient gets depends on the DNA in their individual tumor.
They target specific parts of the machinery of tumor cells with the hope that then you have less side effects because you're really targeting or honing in on cancer cells.
Since April, Keona Clark has been going through chemotherapy once a week. She's also taking a pill twice a day. The whole process has left her feeling pretty sick. But at the same time, doctors have been giving her MRIs so they can monitor how her tumor is responding to that treatment.
You can literally see the first MRI and compare it to the second MRI, and you can see the difference in the size.
Yeah, she's had a phenomenal response.
Doreen Gensler, News 4.
And doctors say they can't even feel Keona Clark's tumor anymore. They don't know whether or not it was the medication or the chemotherapy. Clark will still undergo a double mastectomy and radiation next month.
For years, parents have been told that sharing their bed with their toddler is a no-no. There is some new research out there now that challenges that belief. The main worry is that bed sharing can harm a child